Doctor, you're trained as a neonatal doctor. You deal with
Right.
infants a lot. What, which is very different than treating Alzheimer's. What
Hmm.
kick-started you into thinking, okay, what we're trying here isn't working. I've got to find something else.
Hmm. Well, yeah, with Steve, we were actually trying to get him into a clinical trial for Alzheimer's. There was one a couple years earlier called Florazan that they were um, beginning a clinical trial, and he didn't meet the criteria because he had had a history of depression. And but this time around, that was not a criteria. There was a vaccine from Elon that was supposed to help remove the beta amyloid plaque from the brain, which is believed to either cause or contribute to Alzheimer's disease. And this seemed like a very promising study. Apparently the plaque would be removed fairly quickly once you get this vaccine. And so we tried to get him in to that study, and there's a test called the mini mental status exam, a 30-point test, and he only got 12 points on the test, and he needed at least 16 to qualify. And he had qualified in every other respect but that, so we were fairly devastated at the time. And the physician said, but we could come back in a couple weeks and see if, he could try again and see if he could qualify for the trial. So we scheduled an appointment 2 weeks later, and then another clinical trial became available, and this was an oral medication to help reduce amyloid plaque in the brain. And so I scheduled these screenings for the clinical trials on back-to-back days that I was off. And the night before the first screening, I started thinking, well, what if he gets accepted into both? He can't be in two clinical trials. So I got on the internet and started looking at the risks and benefits of the two drugs to help us decide, which might be better for him to participate in. And I happened upon a press release just purely by chance that included another treatment that at that time was called AC1202, and they had just named it Ketocin. It's now known as Axona, but it was a medical food, and they didn't really say what it was in the press release, but they did say that nearly half the people with Alzheimer's who were given this had improvement in memory. And so this is not something you normally hear about, Alzheimer's medications. They basically say they slow down the course of the disease.
Right.
They don't improve memory. So I thought, well, this is very interesting, but what is it? So I continued to look on the internet, and I came across their patent applications on free patents online, and it was about a 75-page long document, and I learned a lot about Alzheimer's and that a whole aspect that I was not aware of with Alzheimer's disease, that there's a problem of insulin deficiency and insulin resistance in the brain. And basically, this starts happening about 10 to 20 years at least before a person has symptoms of Alzheimer's. And there's a problem with getting glucose into the neurons, and the neurons basically malfunction over time and eventually die. And once there are billions of neurons. So apparently you can compensate for quite some time until a certain number of them die off, and then you won't be able to compensate. You'll start having symptoms as you start losing certain pathways in the brain. So it's basically a problem of getting energy into the cells. And our most common, the energy that we normally use for most of our cells most of the time is glucose, to fuel our cells. In the U.S., we have a high carbohydrate diet. We're not starving, so glucose is our primary source of energy. But in this patent application, one of the things that they made a point of was that during starvation, you switch over after 24 to 36 hours, after you use up the carbohydrate that you have stored in your body, you switch over to using ketones as an alternative fuel for the brain and other organs. And so ketones come from breakdown of fat normally. You start breaking down fat, and some of your cells can use just your basic fatty acids. The heart and muscles use fatty acids, but these longer chain fatty acids can't cross the blood-brain barrier. And so the brain doesn't have access to those. And what happens are the fatty acids are also converted in the liver to ketones, and ketone bodies do cross the blood-brain barrier and can be used by cells as an alternative fuel. So this company had the brilliant idea that if you could raise ketone levels with something you consumed, that this could potentially provide cognitive improvement, that it would fuel the neurons would function better, and you'd have improved cognition and memory and this type of thing in somebody with Alzheimer's. And what the food that they use is something called medium chain triglyceride oil. And I was familiar with that as a neonatologist because back in the late 70s and early 80s, we were using it to, with our premature newborns, we were adding it to their formulas. Every feeding we'd give them medium chain triglyceride oil because it was well absorbed and it did help them grow. And then they started adding it to the formulas and making premature infant formulas that are higher calorie than full-term baby formulas. And so the medium chain triglyceride oil, when it's taken in, when you eat it, it doesn't require digestive enzymes. It's taken directly into the liver where part of it's converted to ketones. And this is a very unusual, it's the only food that I'm aware of, are the medium chain triglycerides that are converted by liver to ketones. But again, they cross the blood-brain barrier and can provide energy to the brain cells. So one time in the patent application, it mentioned that medium chain triglyceride oil is extracted from coconut oil, that's where these come from. And coconut oil is the richest source of medium chain triglycerides. It's nearly 60% medium chain triglycerides.
Okay.
So I got from them an idea of something else that might be available there to help Steve.